Welcome to my podcast. I'm going to today talk about another case. It's basically about arm or elbow pain. So, after you introduce yourself to the patient and double check the patient name and address, you'll ask, how can I help you today? So, the patient might say that, oh, doctor, I'm having pain in my elbow, I'm having pain in my arm. So, the patient will tell you more about it. Basically, the patient will say, well, I'm having this pain a few days ago, or since some time, or if it's an acute, or if it's chronic. So you're gonna ask how did it start? Any thing you could think that might be linked to the cause of the pain, and also you will ask how did it start? Any time of the day if the pain is too much, and of course always never to forget about the scale of the pain from 1 to 10, where 1 is the lowest and 10 is unbearable pain. You will ask if there is any fever at all, if there is any swelling, if there is any redness, if the patient able to use the elbow or the hand in general or not. And you will ask if there is any thoughts or ideas that the patient might had about the cause of the pain. And also you will ask if there is any past medical history that you should be aware of, any medication that the patient take, if the patient had done anything to ease the pain by themselves, if they take any OTC or applied something for the pain. You will ask about also any known allergy, family history of any known illness, and you will ask also about basically the lifestyle of the patient, if they are doing any sort of exercise, what kind of work they do, whom they live with, if they are supported or not by the people around them. And also you will ask about, of course, the drink and the smoking habit. And then you will ask the patient that I would like to examine you and see if there is anything that might be of concern. And while taking the history, you'll try to think about certain differential, of course, according to the age of the patient and according to the lifestyle and any sort of exercise or manual thing they are doing. So if there is any stiffness, any swelling, any difficulty in movement, you might think of inflammation of the tendon, if there is any bursa. Also, if there is any history of bruising or tenderness, you might think of sprain, strain, if the patient doing any manual work, excessive and repetitive. So it could be this is one another cause. If the patient says, for instance, I'm having stiffness, pain around the shoulder area or the arm, you could have think of frozen shoulder. And also you can think of arthritis, generally speaking. If there's any fever, hotness, the patient may be very ill, feeling hot, pain, shivering. So all of that could point to infection, and could be infection in the joint, like septic arthritis. So we need to know what might be the reason for that. And then after you examine the patient, basically for any swelling, any abnormal physical thing that you could see, any deformity, any abnormal pulsation, any swelling, any bulge. You will check also for the temperature, any tenderness, and then the pulsation. And then you will instruct the patient if there is any pain or tenderness to raise their arm. So you might do like a sling, whereby it will elevate the forearm a little bit, so it could ease the pain. You will prescribe painkiller, the form of paracetamol or ibuprofen, and of course the idea of frozen piece wrapped in a towel, which can be applied and on the day, and can be changed from 2 to 3 hours. And then, after you agreed with the patient about the management plan, you need to safety net the patient and says if the pain did not ease at all, if your condition gets worse, if you're feeling that there is nothing seems to be right, if you feel any numbness, tingling sensation, snapping, popping sound, all of that, you need to basically attend to the surgery or call 111 or go to the A&E. So that's basically about the elbow pain. If there is any association, for instance, in the shoulder, in the jaw, and it was all of a sudden abrupt and the patient feeling sweat, too much pain, you need to think about, of course, heart issue like angina or myocardial infarction or broken bone. So that's another differential you need to think of. Also, tell the patient you need to rest the area and not to overstrain in order for the pain to ease and any sort of issue there in order to subside gently. So by that, I hope that I covered the main differential and the way how to approach, generally speaking, elbow and arm pain or shoulder pain. And I see you in another podcast. Thank you.